Many adults over 60 believe that taking a few vitamins each day is a simple way to protect their health. But the surprising truth is that some familiar vitamins can actually weaken the body, increase fatigue, and even raise disease risk over time. At this age, the liver, kidneys, and blood vessels no longer process excess vitamins as efficiently as they did in the 40s, which means something once appropriate can become a hidden health trap at 65. In today's video, I will share 4 vitamins older adults should avoid, and 4 nutrients that can deliver real benefits. One of them is even linked to a 36% reduction in mortality risk. If you are still watching, please leave a quick comment to help this video reach more people. The first vitamin older adults need to be very cautious about is vitamin A in the retinol form, often labeled as retinol palmitate. This is a synthetic fat-soluble form of vitamin A, which means the body cannot clear it as quickly as water-soluble vitamins. When younger, the liver can handle the excess fairly well, but after 60, metabolism slows and fat tissue changes, making it easier for retinol to accumulate over time. The danger is that symptoms of excess vitamin A look very similar to normal aging: dry skin, blurry vision, fatigue, joint discomfort, or reduced stamina. Some studies even show that chronically high retinol levels may increase atrial fibrillation risk by around 25%. A major factor linked to stroke in older adults. The safe upper limit for adults is about 700 micrograms per day for women and 900 for men. Avoid supplements containing retinol or retinol palmitate, and choose vitamin A from beta-carotene in vegetables, which the body converts only when needed. If retinol can build up slowly, supplemental iron is even more concerning because many adults over 60 keep taking it daily without knowing they already have enough. After menopause or late adulthood, the body hardly loses iron naturally, so adding more can lead to overload. Iron cannot be excreted, and once it settles in the liver, heart, or pancreas, it acts like rust, triggering oxidative stress and silent inflammation. Research shows that long-term iron excess increases the risk of dementia, heart disease, and liver disorders. The symptoms are vague: joint aches, fatigue, rapid heartbeat, or mental fog, so they often get mistaken for aging. The problem is that many senior multivitamins still include iron, even though most older adults are not deficient. Combined with iron from red meat and fortified grains, the risk rises. Always check your labels, and only supplement iron if blood tests like ferritin or transferrin saturation confirm a true deficiency. After discussing excess iron, we need to address another very common misunderstanding: taking large amounts of calcium to strengthen bones. After 60, the bones do not absorb calcium as effectively, so calcium from pills easily ends up lost in the arteries, joints, or soft tissues. This is why many studies show that taking calcium alone can increase heart disease risk by over 20%. Excess calcium also contributes to kidney stones and reduces the absorption of other minerals, making joints feel stiff and legs feel heavier. Many people take more calcium and end up feeling worse without realizing the supplement is the cause. The key point is that calcium cannot act alone. It needs vitamin D3 for absorption, K2 to guide it into the bones, and magnesium to keep balance. Prioritize calcium from leafy greens, almonds, yogurt, or soft bone fish. If you must supplement, pair it with D3, K2, and magnesium, and maintain weight-bearing exercises for long-term bone strength. If calcium alone can trigger silent calcification, the most dangerous vitamin on the list is something many people assume is harmless: high-dose vitamin B6. Because B6 is water-soluble, it is often advertised as safe, but in reality, long-term high doses can accumulate in nerve tissue and become toxic. In adults over 60, the liver clears more slowly, and the nervous system is more sensitive, increasing risk. The concerning part is that B6 toxicity looks almost identical to aging or diabetic nerve damage, tingling or burning in the hands and feet, poor balance, weak muscles, dizziness, or brain fog. Many people take extra B6 to improve nerve health, but unknowingly make their symptoms worse because they have already exceeded the safe limit. Although the upper limit is 100 milligrams per day, Nerve injury has occurred even at 50 milligrams long-term. The true need for older adults is only about 1 to 2 milligrams. Choose B6 from foods like turkey, fish, or bananas, and if supplementing, use low doses of 5 to 10 milligrams, and always check labels to avoid accidental stacking. So far, we have covered 4 vitamins that seem harmless but can become real risks after 60. Avoiding them is the first step to protecting your body from silent damage that often goes unnoticed. But avoiding mistakes is only half the story. What matters even more is providing the right nutrients your body truly needs at this age to restore energy, memory, and mobility. In the next section, you will see 4 nutrients with strong scientific support for improving health in older adults, including one that is linked to a 36% reduction in mortality risk. This is the part that helps you rebuild health from the inside out. The first nutrient in the best category, and one that nearly every adult over 60 is lacking, is magnesium. This is a silent deficiency that affects many essential functions. When magnesium is low, you may struggle with poor sleep, nighttime leg cramps, long-lasting fatigue, irregular heartbeat, or unexplained palpitations. Magnesium is involved in more than 300 biochemical reactions, stabilizing heart rhythm, helping muscles contract and relax properly, supporting nerve signals, managing blood sugar, and strengthening bones. When deficiency continues for years, the risk of atrial fibrillation, diabetes, chronic inflammation, and cognitive decline rises. This is why many specialists see magnesium as a reset nutrient for older adults. When supplementing, avoid magnesium oxide because it absorbs poorly and often causes diarrhea. Better options include glycinate, citrate, or malate, at about 250 to 400 milligrams daily. Magnesium-rich foods include leafy greens, pumpkin seeds, almonds, avocados, beans, and dark chocolate. But because soil minerals continue to decline and many medications lower magnesium, food alone is often not enough, making a high-quality supplement a smart choice. If magnesium stabilizes muscle and nerve function, the next nutrient acts like a central switch for the health of older adults: vitamin D3. After 60, the ability to make D3 from sunlight drops by more than half. Less time outdoors, sunscreen use, and living in low sunlight regions make deficiency almost inevitable. Vitamin D3 affects many systems. For bones, it works with calcium and K2 to place minerals where they belong. For muscles, low D3 weakens strength and increases fall risk. The immune system also depends on D3, and studies show deficiency may increase all-cause mortality risk by about 30%. To restore levels, most older adults need about 1,000 to 2,000 IU per day, often more than what is found in multivitamins. Choose D3 in the cholecalciferol form and take it with a meal containing fat for better absorption. If D3 is the central switch for muscle and bone function, the next nutrient acts like the ignition spark for the nervous system and blood: vitamin B12. About 1/4 of adults over 65 are deficient without knowing it. The reason is simple. The stomach produces less acid with age, making it harder to release B12 from food. Many common medications, such as acid reducers, stomach drugs, and metformin, also sharply reduce absorption. When B12 runs low, the early signs mimic dementia or aging. Long-lasting fatigue, anemia, tingling or pins and needles in the limbs, poor balance, brain fog, and low mood. To rebuild levels, most older adults need around 500 to 1,000 micrograms of B12 daily to compensate for poor absorption. You can choose methylcobalamin or cyanocobalamin, ideally in a sublingual form. Foods like eggs, fish, dairy, and beef do help, but if the stomach is already weak, they are usually not enough to restore normal B12 levels. If B12 is the spark for nerves and blood, the top nutrient is directly connected to longevity: omega-3, especially EPA and DHA. Many studies refer to omega-3 as a longevity nutrient because higher levels are linked to up to a 36% reduction in all-cause mortality. Omega-3 is powerful for reducing chronic inflammation, easing joint pain, protecting muscles, and keeping blood vessels flexible. For the heart, omega-3 helps reduce arrhythmias and lower triglycerides. For the brain, DHA is a major structural component that supports memory and stabilizes mood. Omega-3 even helps protect telomeres, the protective ends of DNA, slowing cellular aging. The problem is that nearly 70% of adults over 60 do not get enough omega-3 because they eat very little fatty fish and consume large amounts of omega-6 oils from corn, soy, or canola. To improve levels, aim for 2 to 3 servings of fatty fish per week and supplement around 1,000 milligrams of combined EPA and DHA daily. Choose a purified high-quality product in the triglyceride form for better absorption. Vegans can use algae-based omega-3 to obtain DHA. We have now covered 4 vitamins that may be harmful after 60 and 4 nutrients that truly support strength, memory, and mobility. The most important lesson is that a label saying for seniors does not always mean safe. The difference between decline and thriving comes from small daily choices, from supplements to meals and the habits you keep. Tonight, take a moment to review your supplement labels, ask your doctor about essential vitamin tests, and begin replacing harmful options with nutrients that help your body recover. I also want to know which vitamins surprised you the most and whether you are currently taking any of them. If you found this video helpful, please like, subscribe, and turn on notifications so you never miss content designed to help you stay strong longer. And remember, your best years do not have to be behind you. This video is for educational purposes only and does not replace medical advice. Consult your doctor before making changes to supplements or diet.